السلام عليكم يعطيكم العافية. This week's lectures will cover the gram-negative respiratory rods. I have uploaded a few pictures of algorithms of how we can detect bacteria. You can see in this picture, I think it's on the teams, that may have been given different names like Coccobacilli or something else. But basically, these are the non-enteric gram-negative rods. بعدين راح نحكي عن gram-negative cocci after that, and then we'll cover the gram-negative enteric bacteria rods. Okay, so these are respiratory organisms. They are related to the respiratory tract. Of those, we have three that we will cover in this lecture series. We have Haemophilus influenza, اللي هي حكينا this is the representative for the gram-negative rods of the meningitis causing bacteria. This is a capsulated bacteria that causes meningitis, and is one of the major. فهلا صرنا مغطيين اللي هي gram positive coccus اللي هي pneumococcus. while gram negative rod here is our H. influenza. So it causes meningitis. It also causes other upper respiratory tract infections, otitis media, sinusitis. It can cause another emergency situation. It's called epiglottitis. This is unique for Haemophilus influenza. It can infect the epiglottis and cause it to swell profusely to the point that it will close the trachea, and the patient, and usually a child, will not be able to breathe. الثانية تكون بورديديلا بيرتاسيس اللي هي بتعمل سعال الديكي whooping cough. and then ليجينيلا بجوز سمعتوا عنها قبل السنة الماضية. بجوز ليجينيلا لما صارت بالبحر الميت in a hotel in the water supply, so in the AC in the water supply. So this is Legionella that we have. So we will see that the lab diagnosis for these is quite different. For H. influenza, we do a regular culture. We look for the capsid polysaccharide in the serum or the spinal fluid if we are looking for meningitis. For Bordetella, we do fluorescent antibody or for secretions and culture, whereas Legionella, we do really serology, culture, maybe urinary antigen as well. هلا we will see that H. influenza, this has a unique, Bordetella has a unique medium. راح نورجيكم إياه. H. influenza, it grows on regular chocolate agar, but it requires this agar to be supplemented with factors 5 and 10. So this is important for its growth. So this has a unique growth method. This has a unique growth method, and this you will see has a unique growth method. So all these respiratory organisms have unique growth methods. Vaccine, حكينا كل اللي بيعملوا meningitis have a vaccine. So this one has a vaccine. وهذه هي من الموجودة اللي هي موجودة بالregular vaccination schedule اللي هي whooping cough أو pertussis اللي هي acellular pertussis بتعرفوها. So we covered the vaccine. Prophylaxis, كل تبعين meningitis we do prophylaxis with rifampin, whereas pertussis you will see this is unique where we use azithromycin, whereas Legionella really has no prophylaxis. So this is basically our lecture series here, and we're going to cover the details now. Haemophilus. This used to be the leading cause of meningitis in young children. Used to be the top. Pneumococcus now is the top. So now we have meningococcus. راح نحكي بالgram negative rods. Cocci, gram positive cocci هي pneumococcus, and this is the gram negative rod. حكينا gram positive rod اللي كانت listeria. So now gram negative rod here, Haemophilus, is also the respiratory capsulated organism that is the third most common cause of meningitis. So a conjugated vaccine against this capsule has greatly reduced the incidence of meningitis caused by this organism. it is still an important cause of upper respiratory tract infection. لا زالت a very common cause for otitis media خاصة بالأطفال. Sinusitis, conjunctivitis, and حكينا the dangerous one would be epiglottitis. And if it can progress to more severe infection, it can cause sepsis. حكينا sepsis because this is a gram-negative rod or gram-negative, so we'll have an endotoxin. The most significant dangerous disease will probably after meningitis would be epiglottitis زي ما حكينا. important properties. شو عندها properties بتخليها تعمل هالأشياء؟ So it has a capsule, so it's just like any other capsule. This is an important. It has this pyogenic mechanism of causing disease. إذا نستخدم serology نقدر نفرق الهيموفيلس into 6 groups A, B, C, and D, and 2 more, but the dominant one is serotype B. عادة we usually saw HIB. نحكي كلمة HIB, Haemophilus influenza type B. HIB is the most significant one and the most dangerous one, and it causes more illness من meningitis, epiglottitis, and sepsis. Type B capsule is composed of polyribitol phosphate, which is another antiphagocytic and invasiveness factor. So unencapsulated strains زي pneumococcus do not cause disease. Growth of this organism, it requires supplementation with heme, factor 10, coagulation factor 10, and NAD factor 5. So this is what it looked like. سموها Coccobacillus. So it's a short rod, not quite a circle, not quite a long rod. Another more pictures. So if you look at this, you might see shorter ones that may look like this. So we do not. فبس بنشوف longer ones here مثلا, longer one here. لما نورجيكم المننجوكوكس راح تشوفهم they usually come also in pairs. So it is sometimes quite difficult to distinguish the two just on a regular microscopy. So pathogenesis and epidemiology, it infects only humans, no animal reservoirs. So زي ما حكينا, this is common for all upper respiratory tract pathogens, ما إلهم animal reservoir. This is true for pneumococcus as well as HIB. مثل other respiratory pathogens, it is transmitted by inhalation droplets. كل اللي بيعمل upper respiratory, كل اللي بيعمل respiratory organism by respiratory droplets. This is the transmission method. A lot of people can be asymptomatic carriers or colonized asymptomatically by this, and then if the bacteria invades or has the patient has a spell of reduced immunity, مثلا تعب, travel, another infection, whatever, it can take an opportunity and cause an infection. Another thing that is common مع كل respiratory organisms واللي بيعملوا meningitis is the presence of IgA protease. This is something that we covered before. It has to have the ability to degrade the IgA that coats the pharynx and the upper respiratory tract. Otherwise, it will not be able to bind to the receptors. So, all these three mechanisms are, all of them are in all the four or the three major meningitis-causing bacteria. So, capsule, no animal reservoir, inhalation of droplets, IgA protease, presence of capsule حكيناها, and then once they gain entry into the blood, they can spread into the meninges. So it's a short, it's a relatively short trip from upper respiratory tract to the very close meninges. So as mentioned, وخاصة من خلال if you go through the cribriform plate, this will be a direct invasion. So, as mentioned, capsulated strains cause meningitis. Meningitis with HIB has been greatly reduced by the vaccine. It has pushed other types of Haemophilus influenza to become more dominant. ما في other, ما عندهم endotoxin, ما عندهم exotoxin ولا immune mediated disease. This is just purely pyogenic. Age group, Hemophilus 6 months to 6 years, and it peaks at the 1 year mark. This is significant. Why? Because this is where people might have the يعني لسه ما صاروا fully immunized yet. So this is where it becomes later ages are usually more have been covered with immunization أكثر. This is significant to the fact that symptoms would be harder to detect the meningitis بالأطفال الصغار, which is this is the scary bit. What are the symptoms of meningitis that you see? So fever مهمة. Some signs of meningism, which is stiff neck and photophobia. They can't really look at light. يحاولوا يغطوا عيونهم. Maybe the neck hurts. Moving, stretching the neck produces pain. هذا كلهم are signs of meningitis. Epiglottitis, they are drooling, they can't swallow, and they are regurgitating fluids. So that tells you that there's an obstruction very high up in the respiratory tract. So why after 6 months? This is when you lose the cover of your mom's IgG, and you still haven't been fully immunized to produce your own coverage. So clinical findings: meningitis. حكينا هو بيعمل signs of meningism, fever, headache, stiff neck, neurological symptoms, photophobia, drowsiness is very typical. Upper respiratory tract infections, so pain in affected areas, sinusitis مثلا. sinusitis usually بحكي لك المريض إنه dull constant pain in the area of the sinus. ومع تغير الوجه كمان بتزيد. مثلا لما يسجد مثلا it can block the أخذته الاناتومي, so it can block more, cause more blockage and more pressure buildup, and might bring up more pain. H influenza is the second only to pneumococcus as the cause of these two infections. If any of these capsulated organisms that cause meningitis, they are anybody who has lost their spleen. Asplenic, you need the spleen to. This is very very common بالboards مثلا تبع USMLE or whatever, comes a lot. So an asplenic patient will not be able to cover which organisms. مثلا شو بتخاف منه, شو بدك تعطيه vaccine مثلا, so you want to cover him with السحايا meningitis. Because ليش meningitis? Because they will have pneumococcus, we'll have this one, we'll have meningococcus and whatever. So epiglottitis, it's rare but can obstruct the airway. I've seen one just last year, so it's not that rare. عادة في أطفال مثلا ما بياخذوا كل المطاعيم أو they skip a vaccine. ومثلا بين دكتور ودكتور هذا يعني واحد ما انتبه. So you might have a lapse. يعني don't be very reliant on vaccination. What do you see? You can see a swollen cherry red epiglottis. If you can see the drooling, the stridor. Stridor is a very high pitched breathing noise. يعني لما يكون في tiny opening for the airway, لما ياخذ نفس يعمل هيك صوت. This is a stridor. Is probably will be higher pitched than what I just imitated for you. لما تعمل له X-ray, هي الاير, شايف الاير من هنا, شايف this is the black wall, this is the air, and you can see this very big bulging that is blocking the air. كل الاير بس بدخل من هنا عاد. So this is epiglottitis. لما تطلع على airway, this is what the epiglottis would look like. Very nice. This is a very swollen epiglottis. This is epiglottitis. Lab diagnosis حكينا. So you can grow it on chocolate agar, much like Neisseria. So you can always use chocolate agar and blood agar for these all the organisms that cover these meningitis. بس بهذا بدها factor 10 and factor 5 added to the plate. Otherwise, it will not grow. So any organism that grows on chocolate agar only in the presence of X and V is assumed to be HIP. Killing reaction, تذكروا حكينا. So if you give the antibody and the bacteria swells, that can be a way. تستخدم عادة تبع الB اللي هو the most dominant ones, and you can see the killing reaction. otherwise you can do fluorescent antibodies. هذا طبعا راح يزيدوا لك السنسيتيفيتي كتير عاليه لانك بتشوف مثلا in a dark background this very shiny and lighting object which can increase your chance of catching even the smallest bacterium. treatment حكينا meningitis كل المننجايتس تخاف منهم هذول قاعدين نضيف اشياء كلهم we are clumping them together. ceftriaxone لا تنسوا ceftriaxone is extremely important is for meningitis and all these serious infections by these organisms. So ceftriaxone third generation cephalosporin is what we use. عادة هون حتى يعني بعض الأطباء حتى بيعطوه empirically just at the sign of fever with meningism sign بلشوا فيه على طول يعني. From 20 to 30% of H influenza they can produce beta-lactamase that degrades penicillin sensitive but not ceftriaxone. It's important لازم نبلش الانتيبيوتيك treatment طبعا very quickly because incidence of مثلا empyema, subdural empyema or other neurological consequences are very high. Untreated طلع the fatality rate is 90%, so this is a very serious infection. The less serious ones عادة amoxiclav تقدر تعطيه or sulfatride, both these mixes so they can give for this. In prevention and the vaccine. So we have vaccine. So the vaccine عادة against the type B. Depending on the carrier protein is given sometime between the ages of 2 and 15 months. The vaccine is much more effective in young children than unconjugated vaccines. حكيناها بالimmunology. Meningitis in close contacts of the patient can be prevented by rifampin. This is, we know, because of its the high presence in the saliva. So this is the where. So we'll cover the upper respiratory tract very nicely. الثانية بورديتيلا. بورديتيلا اللي هي بتعمل pertussis. This is the cause of whooping cough. So it is still seen, especially in infants under 2 months of age. Received again no little protection from the mother. Usually this is the same story with that we see in with Haemophilus. Pertussis, Bordetella is a gram-negative rod also. Fucobacillus also encapsulated. It infects only humans again. It's respiratory droplets again. Once it finds its way to the epithelium of the upper respiratory tract, it attaches itself and causes, this is without invading the tissue, it causes a reduction and eventually death of the ciliated epithelial cells. So now at this point هذه السيليا اللي تتحرك بتبطل تتحرك والخلية اللي فوق اللي هم the top layer of cells will die. So now you have lost the ability of your ability to clear mucus. So mainly affects children and young adults. It is similar to other respiratory pathogens in a way is that it's very highly infective and it is more than that. هلا راح نحكي كمان نقطة ثانية. This is why this organism is one of the target organism in scheduled vaccine. لما يصير في lapse of vaccination this can cause outbreaks. يصير مثلا outbreaks بيطلع عن دول السنوات 5 و10 و 12. So in any area where adults have stopped giving the vaccine and this is صرنا نحكي حتى كمان إنه بدنا نعطي vaccine the pregnant women to improve their immune globulin count so they can cover their children in a better manner. هلا البرtussis it has a toxin. It has a toxin. So this one has a toxin. It has direct invasion. So once it invades, it kills the cilia. So it attaches to itself to the cilia, kills these, damages these cells. So there's no more cilia. بيطلع معنا هنا البرtussis toxin. شو بيعمل التوكسين؟ It is an enzymatic ADP ribosylation of the G proteins اللي هم بيتحكموا بالcytoskeleton through the use of cyclic AMP. So this will similar زي الموجود بالدايرية cyclic AMP زي ما حكينا. So this increases the extracellular secretions. Now a lot more respiratory secretions are being produced. فكروا فيها إنه هذا التوكسين شو بيعمل؟ By production of intracellular cyclic AMP زي كأنه بيعمل diarrhea. The same mechanism of diarrhea but inside the respiratory tract. هلا أنت ما عندك clearing of mucus. Now you are making a copious amount of mucus and you can't clear it. So both of them will give a very, very severe collection of mucus that cannot be expectorated. The only way for you to expectorate it إنك تطلعه is to push with your muscles, your respiratory muscles, which is coughing. عفوا خلينا نكمل. So the only way for you to clear this mucus, the only thing that you have right now is the cough. So they have to do a very strong, prolonged cough, which is, if تفتح على YouTube, you can hear some examples of this, this whooping cough. So the pertussis toxin is part of the DTaP vaccine, and all three components of this vaccine are AB, ذكروا binding, the binding part, and the active part. So patients with pertussis exhibit a high number of lymphocytes in their blood, so they have lymphocytosis. Why? Because the pertussis toxin has the ability to inhibit signal transduction. So again, in the same mechanism, by affecting the G proteins, and then this will have chemokines accumulation, which in turn cause an inhibition of lymphocytes entering into the lymph tissues, so they remain outside. So this is a relative lymphocytosis. So the organism also synthesizes and export adenylate cyclase. This enzyme, when taken up by the phagocytes, it prevents them from doing their activity, which is to kill the cells, so they can't kill any more bacterial cells. So mutants of Bordetella that don't have this activity are avirulent. So تخيلوا ما بيقدروا يعملوا أي disease. So this is actually important for their disease pathogenesis. And then the last toxin that is produced by Bordetella, هلا صرنا عندنا Bordetella والدفتيريا اثنيناتهم بيعملوا upper respiratory tract infection, and both are toxin mediated. So tracheal cytotoxin is a fragment of the bacterial peptidoglycan, and alongside other toxin can induce nitric oxide. بتعرفوا this can kill the ciliated epithelial cells. Clinical findings. شو عندنا whooping cough. Begins with very mild symptoms, sneezing, coughing, low-grade fever, تمام. So, and then develops into an acute tracheal bronchitis followed by a severe paroxysmal يعني sudden outburst. ما إلها clear cut condition. يعني إنه إذا بعمل هيك، إذا ببرد، إذا بوقف، إذا أبصر. No, it just comes at any time and then starts have a very long session of cough. So it's characterized by this hacking cough, production of a very large amount of mucus, which is ended by a very inspiratory whoop to catch their breath after this very long cough. This is usually done. The whoop is due to narrowing of the glottis. The organism is restricted to the upper respiratory tract. Blood cultures will be negative. Although central nervous system anoxia and exhaustion can occur during the coughing fit, death is mainly due to pneumonia. Classic picture. What is the classic picture? It's primarily a young child. It does not really affect adults. It will be very rare to have them. Although صاروا هلا الأيام صريحكم مثلا, if someone has a very prolonged cough that is months on end, you have to investigate them for pertussis. So from these certain atypical strains, or maybe reduced immunity, reduced titer for immunity in some patients, then they have a subacute infection with this bacteria. So what is the clinical course? So you have an incubation period, usually about 5 to 10 days, and then this is when after that the onset starts. After the symptoms start, this is where the patient is infectious. So the first probably couple weeks, this is where they have a lot of the insidious stage, catheteral stage, and then they have the paroxysmal stage where they have the actual cough, and then they have a convalescent stage where they are improving slightly to a 12-week period almost. What do we see in adults? Clinical infection manifests as a paroxysmal cough, حكينا of varying severity that may last weeks, even months. And then ما فيش الوب عندهم الابيجلوتس بتكون أكبر, so they are able to maintain airway أحسن من الأطفال, so they don't have the actual whooping cough nature. In the correct clinical setting, adults with a long-lasting حكينا high should be evaluated for pertussis. Lab diagnosis حكينا everyone has a special way. So في شيء اسمه بوردي culture media, which is a special culture media that grows this organism. إذا بتشوفوا أتوقع تلاقوها بكتاب الفيرست aid, and it's one of the things that you should know of the special media. This is one of them اللي هي for pertussis. هاي موجود بوردي جنجو medium, هاي موجود, used for this purpose, contains high percentage of blood and inactivate inhibitors. تمام. The organism is then identified by detecting other. We can look for antigens. عادة هذا اللي نعمله حاليا. إذا بدك تعمل نعمل antigens. This is what we look for. The reason why we do that is because of the slow nature of the growth of this organism. Rapid diagnosis is mandated sometimes, and then you want to get your results quickly. PCR remains a very solid standard. مستشفيات زي مستشفانا will probably depend on PCR due to its availability. It's more available than buying antigens and antibody tests. But we have the ability for both. Treatment, هون حكينا azithromycin is the drug of choice for pertussis. بتشوفوا مثلا صار يعطوه الناس for unexplained cough, بيحكوا خذ مثلا Zithromax. They can have a course that might clear up their cough. It is essential to treat early for children especially. It will reduce the bacterial load, it will reduce the complications, it would reduce the progression of the disease, it would reduce the course of the disease, but it's important to treat early. Supportive care during the paroxysmal stage is important, especially for infants. Prevention, حكينا, part of the DTaP. So an acellular one, whole AP, contains 5 purified antigen proteins with no cells, and this is the most used vaccine. Acellular يعني بس proteins, no cells. Killed vaccines هو القديم, that some countries still rely on that. The main immunogen in the acellular vaccine is the inactivated toxin, the pertussis toxoid, that is modified to become inactivated, that will be unable to cause any symptoms. This is probably the first vaccine that we use that has a genetically inactivated toxoid. So this is a recombinant, the first recombinant vaccine. The other antigen is the acellular vaccine, humula filamentous hemagglutinin. You don't have to memorize them. The acellular vaccine has a fewer side effects than obviously than the killed vaccine. It's usually given combined with diphtheria and tetanus. So had DTaP and 3 doses that begin at the age of 2 months. They can give a booster at 1 year and then another at the time of entering preschool, so around 3 or 4. So زي ما حكينا for outbreaks بيحكوا قاعد يحاولوا يعطوا teenagers وبيحاولوا يعطوا pregnant women as well to protect newborns. Encephalopathy in this, the killed vaccine, not the acellular vaccine, has encephalopathy in about 1 in a million jabs. So that's actually quite a lot. يعني so يعني مثلا بدولة مثلا كبيرة عندهم 40-50 مليون بيطعموا بالسنة مثلا 4-5 million, so you get about 5-6 cases of encephalopathy. So this is only in the killed vaccine. Azithromycin is helpful for people who are exposed as well, so this is also can be added to prevention. Legionella. هلا Legionella it causes Legionella pneumophila causes pneumonia in the community and sometimes in immunocompromised patients in hospitals. So the genus is named after an American Legion convention. صار هادول مثل legionnaires. هدول legionnaires قاعدين بهالconvention كبار بالعمر عندهم COPD بدخنوا. They were drinking يعني alcohol, and then obviously that reduces their cough. So صار كلهم عندهم outbreak of an infection ما كانوا عارفين شو هو بسموه Legionnaire's disease. So Legionella, this is another gram-negative rod that stains very faintly with the gram stain. However, we have to. This is the special way of dealing this. This is a special technique. كان الأولى اللي هي كان الفاكتور 5 and 10 for hemophilus. بعدين حكينا البوردي media for pertussis, and then now we have for Legionella اللي هو the increased time for safranin counter stain. So this is the special mechanism for this one for detection. Legionella in the lung biopsy requires this special technique, which is samohydril silver impregnation stain to visualize this organism. So at the beginning they did a very prolonged safranin counter stain that enhanced its visibility. بعدين صرنا نستخدم اللي هو this silver impregnation stain. خلال هذا the first outbreak ما قدروا يعرفوا شو الأورجانيزم على إنه ما كانوا نعرف اللي هو growth requirement for this organism, which requires high concentration of iron and cysteine. So Legionella are typically in the community and is associated with environmental water sources. وين هم مثلا مسابح, showers, sinks, water taps, ACs خاصة اللي بيكون فيها مية. So all these air conditioners, water cooling towers, هدول في يمكن مية راكدة. فبحكي لك مثلا كانوا يحكوا مثلا قبل فترة لما طلعت هاي الشغلة بالبحر الميت إنه صار يحكوا مثلا قبل إذا بتترك البيت فترة أشهر قبل ما تيجي ما تتحمم إلا لما تفتح المية. This can actually be true. This might help إذا كان tanks are affected. But what we're seeing here إنه it's usually in the water. The organism enters through the respiratory tract, and then not through drinking, through the respiratory tract, and then occurs in the pathology is in the lung. Bacteremia occurs that seeds can cause damage to various organs because it affects the endothelium of these organs, so kidney, brain. And the mechanism of causing damage is endotoxin mediated. So this is just like hemophilus, is just pyogenic in endotoxin mediated way. The typical patient شو بيكونوا immune competent, older man, smokes, consumes a lot of alcohol, so reduced immunity, reduced sputum clearing, بدخن, كبير بالعمر. So this is the typical patient, immunocompromised, acquired مثلا AIDS or cancer patient or transplant patient بياخد steroids. كل هذول can be immunocompromised that may also get the disease. Person to person spread does not occur. فعشان هيك مثلا بالكونفنشن كلهم كانوا قاعدين بالكونفنشن كلهم بتعرضوا للاي سي هذا, فكلهم اخذوه من الاي سي مش من بعضهم. Clinical findings, symptoms here vary from very mild influenza-like illness بسموه Pontiac fever to اللي هو severe pneumonia that can be accompanied with neurological symptoms مثلا confusion and so on, and they have diarrhea زي ما حكينا, proteinuria, macroscopic hematuria. Why all of this? Because it can affect زي ما حكينا the endothelium. Cough is a prominent symptom, however it is not purulent and not very productive بعكس اللي هي pertussis. Hyponatremia, although a common finding in pneumonia, it is more often found in Legionnaire disease, so this is very important to know. هذه بتيجي بامتحانات, بتيجي بالlicence exams. Hyponatremia بالtypical patient هذا. So most cases resolve spontaneously about 7 to 10 days, but in older immune-compromised patients, this can be fatal. Legionella is an atypical pneumonia, so this is a walking pneumonia. راح نضيف عليها بعدين اللي هي mycoplasma. So it must be distinguished from other atypical pneumonia, mycoplasma, pistachosis, and Q fever. اللي راح تعرفوهم هم atypical pneumonia, mycoplasma, viral pneumonia, and Legionella. هذول مهمين لهذا الفصل يعني. So these are causing of walking pneumonia. بيسألوا الناس شو بسموه ليش بسموهم walking pneumonia because ناس بيحكي لك the patient is not so severe that they can't walk. ناس بيحكي لك no because on the X-ray the findings change مرة هون مرة هون مرة هون, so they are walking. That's another one of saying. Some people say this it's just walking pneumonia. I don't really remember what was the third one. I don't really remember. But I think the walking part is not that severe enough. Is the main one. Lab diagnosis. So sputum gram stain reveals many neutrophils but no bacteria. طبعا it requires special media for growth. It is supplemented with iron and cysteine for you to cultivate it. So you need to grow it on a charcoal yeast agar, supplemented with these two things. Diagnosis then depends on antigen, so you can use these ways. So significant increase in antibody titer مثلا تقدر تشوفوا هذا especially late phase, and the antigen you can detect the antigen in the urine and this is actually the quicker way of diagnosis. If you want to عندك مثلا patient who has atypical pneumonia, walking pneumonia, you want to differentiate from mycoplasma, تيجي هاي كتير cold agglutinin titer does not rise in Legionella, but cold agglutinins are present with mycoplasma. So this is very important. تيجي كتير بالboard exams. Cold agglutinin titer is high in mycoplasma but not in Legionella. شو كانها pneumonic. Yeah, mycoplasma فيها CO, so it has cold agglutinins. Legionella does not have CO, so it does not have cold agglutinins. Treatment and prevention, again azithromycin erythromycin. So راح تشوفوا azithromycin azithromax بنعطى كتير بالحالات النيمونيا. راح إذا أنت خلال مثلا your own practice عندك patient عنده أعراض cough, fever, تعبان, so he has sputum might be productive, might be discolored, so you are prescribing مثلا for upper respiratory tract. So if you take an X-ray and then you find it might be something more insidious, your route عادة of treatment if you are suspecting walking pneumonia إنه تروح for azithromycin. عادة azithromycin هو بيعطوه لهالحالات. Penicillins don't work typically due to the high resistance لهدول الorganisms. These drugs are also effective against mycoplasma. فأنت you cover mycoplasma, you cover pneumonia, Streptococcus pneumonia, and then you cover Legionella. So that's why azithromycin is very famous and very popular for these kind of cases. Prevention involves reducing cigarette and alcohol consumption, eliminating aerosols from water, cleaning the water supply, chlorination, temperatures مثلا, and then there is no vaccine for this. We stop here. This is for the gram-negative respiratory rods. راح نحكي هلا نبلش gram-negative المحاضرة القادمة gram-negative كوكساي ويعطيكم العافية.